We have a 20-year-old woman in the army who collapses during an hot day at basic training. She was in an excellent state of health before this event. 2 weeks ago, she had an upper respiratory tract infection, but she has recovered from that. Her father has chronic kidney disease, who also has bilateral hearing loss, vision problems. At the hospital, the temperature is 40.3, which is super high, and the blood pressure is 85/55, pulse is 105, respiratory is 24. Physical examination says that she has altered mental status and skin is dry, hot, and erythematous. She's complaining of severe bilateral flank pain and generalized myalgia. Catheterization produces 200 ml of tea-colored urine. Urine dipstick is positive for blood, but urinalysis is negative for RBCs or WBCs. What do you think is the condition here? Is it a mutation of the COL4A5 gene or the Neisseria, or is it heat exhaustion, or is it a stroke, or is it an IgA nephropathy? So this kidney thing was because of heat stroke. Why? This patient typically has signs and symptoms of heat stroke because you can see this dry red skin, hypothermia, 40 degrees Celsius, altered mental status, rapid pulse. There are two kinds of heat stroke. Now, what are the two kinds of heat stroke? We have exertional and non-exertional. Exertional heat stroke is usually seen in the younger population that engages in prolonged physical activity in the hot, humid environment. It occurs during periods of strenuous physical activity, as the name suggests, due to thermoregulatory failure that leads to impaired heat dissipation due to loss of sweat formation. When heat gain exceeds the body's ability to dissipate the heat, the body temperature starts going up. Additionally, higher temperatures, humidity, medications, hypothalamic dysfunction can also pose as risk factors for heat stroke. Exertional heat stroke can be complicated by DIC, kidney failure, rhabdomyolysis, and lactic acidosis. This patient most likely has rhabdomyolysis, which classically presents as what? Myalgias, limb weakness, and you will have urine which is red colored or tea colored, whatever, okay, due to myoglobinuria without hematuria. But when you see the urine, it looks red, so you're thinking it's hematuria. But when you see under microscope, there are absolutely no RBCs in the blood, okay? That will tell you it's myoglobinuria, which is very, very dangerous. It will directly kill your kidney injury, okay? uh, could be because of that and myoglobin induced tubular damage. Both together, hypovolemic shock will as such damage your kidney, and if there's myoglobin deposition, which will further worsen it. Now they've given you a pathophysiology of heat stroke here. Now the thing about pathophysiology is if I read it out loud, it's not going to get into your brains because these are the tables you have to assess by yourself. So I'll just give you what happens in heat stroke. We have uh, there's a lot of heat production, but heat's not going out, so it goes up. Remember what happens? We'll have circulatory shock, we'll have DIC, and eventually this will cause multiple organ dysfunction, firstly affecting your kidneys. Okay, that's one thing. Now you need to understand what is the tissue response to exercise, what is the thermoeffector response, and what are the cellular responses to heat. Tissue response to exercise will be what? You'll have increased blood flow, acute phase response, release of nitric oxide. Now that will compete for cardiac output, and there'll be circulatory compromise, which will again cause circulatory shock. Thermoeffector response is what? You'll have vasodilation to dissipate the heat. So you'll have a lot of sweating. Now when there's cutaneous vasodilation, there'll be splanchnic vasoconstriction. That will again go into cardiac output will decrease, circulatory compromise. Splanchnic hypoperfusion will destroy your gut epithelium. Okay, and there'll be release of endotoxin, which will again cause shock, DIC. Now, what are the cellular responses to heat? Cytotoxicity, endothelial damage, release of cytokines. Now, this will cause something called inflammatory response, SIRS, systemic inflammatory response. I think you might have read about this in your recently news for COVID and stuff happening in the kids. Okay, this is something like that. And it will activate what? Coagulation, fibrinolysis, clotting, and break of the clots. So it's causing DIC. So this is how the cycle works. I hope you guys understood this. If not, take a look at the diagram once and you have to assess it on your own. Okay. Now, non-exertional heat stroke is more commonly seen in elderly individuals with a sedentary lifestyle and infants due to their decreased compensatory reserves, such as diminished CVS capacity, hypothalamic dysfunction, and adverse medication effects. Now, the treatment for heat stroke includes what? Rapid cooling, aggressive IV resuscitation, and evaluation for end organ damage. You have to constantly monitor them for renal function, liver function tests, troponins, and all of that, because we are scared of the organ damage that can happen. Very importantly is you have to cool, you have to bring down the heat. And because of shock, we're giving them IV fluids. Benzos can be given to treat what? Seizures or any uncontrolled shivering. Vasopressors can be given to give, bring back the blood pressure to normal. And heat exhaustion is less severe than heat stroke. So just remember that the temperature there is either less than or equal to 40 degrees Celsius with certain non-specific symptoms. The patient's father has symptoms of Alport. The pattern of Alport is X-linked, autosomal dominant, or recessive, depending on which collagen type is involved. The classic triad is you have nephritis, which is hemorrhagic, sensory neural hearing loss, and eye problems, which is exactly what the dad has, right? Kidneys affected, sensory neural hearing loss, and eye. Now, this patient does not have any history of chronic disease and likely did not inherit the condition. Living in close quarter increases the risk of neisseria, yes, but that includes places like dorm rooms, prison, military, and all of that. She is recently healthy and her symptoms of environmental conditions make hypothermia more likely. And having a 40 degrees Celsius in neisseria infection is very rare. Heat exhaustion is less severe. The only thing that would say this is not heat exhaustion is the temperature. Temperature is 40.3. It should either be equal to or less than 40. Remember that, okay? And the other, malaise, headache, fatigue, water deprivation, salt depletion, these are all because of inappropriate replacement of fluids, you can develop these conditions. Okay. Now, even though the patient recently experienced a respiratory infection, her history for exertion, urinalysis results, bilateral flank pain, they all point against IgA nephropathy. IgA nephropathy typically presents as painless hematuria, edema of the ankles and face, and hypertension. It's like a nephritic syndrome. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.